All right. So this is the first meeting of Association of Nurse Executives India, Empower, and good morning, everyone. So I'm going to quickly give you a little introduction on the Empower itself. Just give me a moment. So this Empower we had started for the last couple of years, and our focus has been majorly on patient safety. And this was the thought came from our advocacy committee, and then the central office had taken it up to continue hosting this every month, and we had been successful and we had been very disciplined, and for the last 2 years we have held this every month. And as all of you know, in December last year we had held the safety quiz, the medication safety quiz, which we had done. Not the medication, I'm sorry, the WHO patient safety curriculum quiz was held, and we had given out prizes as well. So we have committed, the Association of Nurse Executives India, we are committed to zero harm, the preventable harms we must prevent. So last year, our education committee, under the leadership of Dr. Rosaline Rachel, had collected 100 patient safety events from all the members of ANEI from various different states. So collected them, and we are hoping that we should be able to publish those events sometime this year. But before that, since the events are already with us, the best way to learn is probably learn from errors. And we all know that. None of us can afford to make one mistake ourselves and then learn from it. So that's why this thought process has come, and we are calling it as life, learning, igniting from errors. As the word says, empower. The reason for hosting all these webinars is only to empower our nurses to become safe by educating themselves more awareness about safe practices, what can be done. So the format that we have adopted is that every chapter, as you have seen in the previous slide, you have seen that. Just a second. So that's the calendar you have there. So every month, one chapter will be hosting this, and members from that chapter will be discussing about this particular event, and it will also give you insights as to how to approach an error when it happens, and how do we go about finding actions which can prevent such events in the future. So this is what the format is going to be, and we are very happy to say that it is being started with the Haryana chapter. But before that, just give me a couple of minutes just to welcome our national officials who were elected last year in December. And we are very happy. A couple of them have joined us. Ms. Ajita Nair, she's the National President. Dr. Unmuna Borgohain is the National Vice President. Ms. Vinci Tribhuvan is the National Secretary, and Lieutenant Colonel Dr. Aji KL is our National Treasurer. We are showcasing this because we would like all of you to know them. And before I welcome Haryana Chapter, I will request Ms. Ajita Nair. I saw her joining in. Thank you for being here. Just a minute of your thought on Empower and the patient safety. Thank you, Ajita. Are you there?
Yes. Good morning, everybody. It's my pleasure to be here. And today we are starting this year's Empower Hour. We had been doing it last year every month, the last Saturday of every month. And 12 of these Empower Hours have been done so far. And as the name indicates, Empower Hour is used for such knowledge and skills acquiring process for the nurses to empower themselves from safeguarding the patients from preventable errors. So that is the purpose of the Empower Hour. And Tanga ma'am has been taking the initiative for this, and this year too. And the patient safety fellows, we have a fellowship with the members, and the patient safety fellows will be taking this, and we have already published a book on various experiences of nurses with preventable errors, and we will be highlighting that in these 12 months series. And very happy to have this, but only my message is that I can see only 30 participants. So anything unless reached the participants or the prospective users is not of much use. So all of you must, tell others to join. And also this will be there in our website so that, somebody missed it can see it later too. It should be used as an education tool for the young nurses, so that they can acquire such skills to prevent the errors in their day-to-day practice. So that is the purpose of these sessions. And thank you so much for participating, and hope to have more participation in the coming sessions. Thank you.
Thank you, Ajita. And very quickly, let me now call in the team. Just a second. So we have this month's Empower Hour being hosted by the Haryana chapter, and we have got Dr. Anu Koshik. She's a ANEI member and she's also the Group Nursing Director of Cloud9 Hospitals. Miss Loveleen Sunil, ANEI member. She's the Chief Nursing Officer, Paras Hospital, Gurugram. And Lieutenant Colonel retired Sandhya Nair, ANEI member. She's Nursing Superintendent, Head Training and Development, Medanta Hospital. And we also are very happy to have Ms. Mohini Betab. She's a staff nurse from Cloud9 Hospital, Gurugram. So as you see, you will see a combination of different roles of this team that is going to discuss. And I really want to emphasize that, there is a quote which says, it's okay to err is human, but failing to learn from errors is a crime. And I would definitely go with Ajita when she said that, when you see such small numbers in an effort like this, it makes you feel sad that, we are not that much focused on patient safety. We have lakhs of students, lakhs of nurses across the country, and we do have a lot of leaders in our ANEI. We really hope that, more and more, members and their, team members will join, because it's very important that the message should reach. And this recording will be available on ANEI's YouTube. You can go at it. And we have planned an interstate quiz at the end of the year based on all these case studies. So there is something to look forward. So we really hope that every month we will start seeing more and more numbers. And a shout out to all the nursing heads, educators, and all the leaders, if you plan, because the date and the link, everything is shared much in advance. If you plan, you can have your 30, 40 nurses sitting in one classroom and actually going through the session. Following that, you can facilitate a discussion so that the retention of what they learned in these sessions can be more. So I cannot emphasize more on that. We need to reach this information to as many nurses and nursing students as possible. And even the faculty who are training, it's a good way of training people to look at something that happened and then, dissect it to see how this could have been prevented. So as I told, each one of us cannot afford to make mistakes to learn from them. So that is why we are going to discuss one preventable error every month, focused for nurse leaders, nurses, and nursing students to learn from, and to prevent such mistakes in their practice and to become more safer nurses. So I will just quickly read the case study for today, and then I'm going to welcome the Haryana team. A female nurse, staff nurse working in the ward cared for a diabetic patient. After checking the blood sugar, the doctor prescribed human mixtard 8 units subcutaneously. She intended the same, double-checked with another nurse and administered the drug. After a while, The patient complained about uneasiness and sweating, and on checking, the RBS was found to be 50 milligram per DL. The nurse administered 8 units of insulin from 100 IU per 10 ml using a 40 units per ml tuberculin syringe instead of 100. So now this is the event that happened. So it gives me great, immense pleasure and pride to invite the Haryana team, including Dr. Anu Kaushik, Ms. Loveleen Sunil, and Miss Sandhya Nair. She has a very long, military title behind her, and Miss Mohini. On the screen, can I request all of you to come on the video, please, and let us admit that there is a mistake. Let's reflect on it, learn from it, and then commit not to make the mistake again. Here, I stop sharing and I leave the session to 4 of you, and I ask Dr. Anu Kaushik to take this forward. And you can tell the rules and everything. So let's go ahead and learn how we could have prevented this mistake of double dosing a patient with insulin. Thank you so much, Anu, Loveleen, Sandhya, Mohini, and you have 60 minutes, maximum 60 minutes you can take. That means about 12:20 or so. And in case we have time, we can open the forum for question answers as well. Thank you. Anu, over
Thank
to
you, Tanga. Yeah, thank you, Tanga ma'am, for that warm introduction. And I think it is very important for all of us to learn from from the mistakes that we have made or the young nurses are making. So, so the incident has already been explained by Tanga ma'am. So I'll just quickly tell you that we are now going to do an analysis of the incident, and I'm going to be acting as a nursing director in this case scenario. Miss Loveleen will be acting as nursing superintendent. Miss Sandhya Nair will be acting as the nurse educator, and Miss Mohini will be the nurse who has committed this mistake. So with this background, I get into a formal discussion with my team to discuss about this error. Good morning, team.
Good morning, ma'am.
Good morning, ma'am.
So I have called this urgent meeting to discuss about an error that happened in our hospital yesterday. And I did get some insights of the incident, and I can only say that we've been really, really very lucky this time, to identify the problem on time and could rescue the patient.
Exactly, ma'am.
So
We actually rescue. We were lucky to.
Yeah, I think God has been very kind. So I would like to understand from all three of you, what is your point of view about this incident, and why I'm asking each one of you to, tell the incident in your own words or from your perception is because I would want to have a holistic view of the incident that has happened. May I request Loveleen to take it forward, and then Sandhya, and lastly Mohin.
Yeah, sure, ma'am. Actually, what had happened is yesterday, Ms. Mohini was on duty on the morning shift. So she had to administer insulin to this patient. So she has checked the dose to be administered and withdrawn the insulin and given to the patient. So after a few minutes, she identified that the patient is getting uneasy. We've also called her for the meeting today. She's there with us. So what had happened is actually she has taken a U100 insulin with a U40 syringe, which actually the patient got 2.5 times more insulin than what he was actually supposed to get. So this is the incident which had happened. As you rightly said, we've been lucky enough that we got saved this time. Otherwise, this had the capacity to be a sentinel event. Actually, we have been lucky. So this had actually happened yesterday.
Yes, ma'am. Actually, thing is that we were indeed lucky, and moreover, with our RCA, me and Loveleen had did it. So we come to know there were the huge gap of both the syringes were kept together, or that was the reason why this nurse got confused. Second thing was there was no recheck policy which was strengthened in that area. Third thing was some of this, whether RBS kit was also ready, so she could identify, and we had given the hypoglycemic treatment and we got it. But there are a lot of gaps which had come, and I would request that we call her, because she's also a little bit of stressed out since yesterday. So we would call out and let her also explain, and we can come to a way that how we can carry it out. So can I call Mohini, ma'am?
Yeah, please do.
Yeah, Mohini, please come.
Yes, ma'am. Good morning, ma'am. I apologize, ma'am. Yesterday on duty, I administered.
Mohini, before you start,
Yes,
I really
ma'am.
want you to relax. I can see a lot of stress on your face. Please, I know, nobody makes mistakes intentionally, they just happen. And, and when an error happened, it is, it has multi factors which are responsible for causing the error. So I actually personally look at an error as a system failure and not as an individual failure. So your incident, I'm sure, would throw a lot of lights on what are the corrective and preventive measures we can take in our system. But at the same time, I want you to, be relaxed and understand that, we all have made mistakes in past. But what is more important is how do we ensure that we, take over the learnings and, disseminate these learnings to others. Okay, so please relax and tell me the incident from beginning to end, and we would like to hear it from you. Thank you.
Thank you, ma'am. Thank you so much for the understanding and for cooperation. Firstly, ma'am, apologize. Ma'am, yesterday on duty, I administered insulin Mixtard by a wrong syringe, that is 100 IU. Actually, ma'am, I was not aware, and it was a very busy duty. And in my previous hospital, I was working where only 100 IU syringes were there in the hospital. And I believed that this was the same syringe, and mistakenly, I have given the overdose to the patient. And also I went to my TL, but at that time she was busy to cannulating a patient. So I was in a hurry. She said, go ahead with the syringe. And she has seen the syringe from a distance. So I go to the patient and I administered with this 100 IU syringe. I know, ma'am, it is my gross mistake, as I didn't read the syringe properly and I didn't recheck the syringe. I'm sorry, ma'am.
Okay.
Mohini,
So
what would have been happened if this would have been like not detected and all?
Yes, ma'am, I agree with this because I know if hypoglycemia is not treated on time, it will cause the irreversible brain damage. So I totally agree, and I realize that it is my gross mistake. And from now onwards, I will definitely do the medication administration in a very, very good manner.
Mohini, you were the one who identified that the patient is not well.
Yes, ma'am, because after a while I went for the vital checking round, and at that time I have seen the patient, and patient was so restless, patient was fatigued, and patient was so lethargic, and I immediately checked the RBS of the patient, and I immediately called my duty doctor, and at that time RBS was only 50 mg per deciliter. So I immediately called my duty doctor, and he has prescribed me to give the dextrose 25%. So I have administered the patient with the same, and I have done this in a very few seconds and very immediate.
good, Mohini. I think I understand that you have made a mistake, and we will talk about the different aspects of those mistakes. But at the same time, it is really commendable that your presence of mind and your keen observation, you were able to pick up the clinical deteriorating signs of patient condition, and you have taken prompt actions. So that's really good. So team, I think after hearing the version of all three of you, I definitely can say that, there are multiple gaps in our own processes, which we definitely have to, discuss and see what we can, do for to prevent such errors in future. So, okay, so as Mohini was mentioning, Lovely and Sandhya, that she is only, she's only seen one type of insulin syringe, and so she probably did not even think, or did not even occur to her mind that there are two forms of insulin syringe available, right? So I'm just trying to understand, can we not look at some administrative controls, wherein we can have only one type of insulin syringe, so that, the nurses don't get confused, because we have nurses coming from different hospitals with different background. So, this particular factor can be rectified and have only one uniform form of syringe, and which you can also include as a part of your induction. I think we can address a lot of issues related to this error. I would like both of you to please opine on this.
Yeah, yes, ma'am. We actually had a discussion yesterday. Me and Sandhya went to the endocrinologist and discussed, as you rightly said, we all are on the same page that we should have only one type of insulin syringe. I mean, one strength of insulin and the syringe. So maybe we can take it up with the purchase team, the pharmacy team, and all, and take off one syringe. Just keep one and take the confusion from the root itself. So that will be really helpful for us. And also, we have called Mohini was mentioning the recheck, that she has asked the team leader for the recheck. She, from a distance, she told that go ahead, it is the right one. So we also have called a team leaders briefing yesterday to strengthen the recheck process. The team leader was supposed to be here, but it is the morning rounds time. She was not able to make it here, but we have done that briefing as well to the team leaders. Yes, we can go ahead with this, keeping just one type of syringe to avoid such confusions in future.
Yes, ma'am, exactly same thing. And the doctor will be drafting a mail regarding some data of his own experience, because he was telling that with immediate effect, there should be only one syringe and we should take it to the administrative level to, so by the time it will take, we actually can segregate all those both the consumables differently. We had a word with the pharmacy, and also we would be briefing all our nurses in our daily briefing points also, and in our daily briefing sessions, that to avoid the only one type of syringes need to be used, and also that the strengthening of recheck policies. So that is need to be, because if the TL would have identified also, we could have prevented that. So we have, as Lovelyn had called a meeting, so we would be appraising all the TLs and the senior the levels of nurses who were second liners. We would be having discussion, we would be appraising them to strengthen the recheck policies. And in the, we would also include this type of the single syringe, which will be using in the wards in our induction program also, so that the nurse who has just recruited, who is in induction, needs to know that which type of syringes is used in the wards. So I hope this will, and by the time we would draft the mail to you so that you can take it to the higher administrative level for keeping one type of syringes.
Okay, so good. I think Sandhya, Lovelyn, you both have come up with very good suggestions. So I think the first step should be, to first of all segregate the two type of syringes and stock them separately, so that the nurses may don't get confused with the two syringes being kept together. So second thing, like as you guys are suggesting on adopting only one type of syringe, I think we need to get a go ahead from the endocrinologist. So maybe I would request both of you to have a meeting with them.
Both have met the endocrinologist, ma'am. So he is also on the same page. He will be sending the mail soon, today.
Okay. Oh, that's wonderful. Then I think we kind of solved this problem to a great extent. So if the endocrinologist is on the same page, then I'll get this approved by the medical head, and then we can make that policy change and get this information percolated down to all our team members, so that we and let's keep a timeline to, ensure that, within next 3 days, we get this process revised and implemented. Is that doable?
Yes.
Right, ma'am.
Okay, now my second worry is, okay, so this is something that, we kind of already handled this. My second worry is on this, verification. I think, so what I understand is that Mohini was aware that there is a process of re-verification. She actually reached out to a senior team member for a verification. Senior team member ignored it, or maybe it's not that she has done it deliberately, but maybe she was busy, as Mohini was mentioning, in handling some other patient. But Mohini, my question to you now here is, you knew that what was the correct process. You knew that your senior has not done a diligent cross verification. So what prompted you to go and administer that medication? Like, did you not think that, okay, should I wait or should I reach out to some senior because because this is a high risk medication and it is not being, verified as per the protocol. You have been inducted on a second verification. So what did you think? Because I'm very curious to know if a medication is not being verified by a senior and you are aware of this fact, but despite that you had gone and given it. So what prompted you to take that action?
Ma'am, actually, I was very busy at that time, and I have 5 patients for the medication, and the medication time was running. So I have to give the insulin to the patient, and I was in a very hurry, so I administered it without rechecking. But ma'am, now I realize that every small step during the medication administration is very, very critical. So my own double check must be there for all the medication, and one should not assume that it is a good to go thing. So I'm really very sorry, and now I surely brief this incident to my co-workers so that they will do the double check and reassure all the things before doing any of the medication administration.
Okay, good, Mohini. Ma'am, that gives rise to another thing, that why don't we appoint Mohini as the medication champ of our department for a period of time?
Yes.
That's a great idea, Loveleen. I think Mohini will be just a perfect candidate for this role because Mohini can, teach others from her own experiences, right? I think she will be the best person to, talk about what is the importance of, checkpoints. Please understand, Mohini, whenever there is a process, being introduced in the hospital, maybe it is a checklist or a process like a double verification, by a senior team member, it is definitely an outcome of some error that has happened in some place. Okay, so if we are just, not paying attention on the importance of every step, as you rightly mentioned, now you have understood it because you have actually experienced it yourself, right?
Yes.
And I think all of us, Sandhya, Loveleen, and myself, we are pretty confident that you will never ever repeat this mistake, right? So we want you to be our medication safety champ and want you to be, advocating to the nurses in the hospital, in your department, other departments, on the importance of important checks and also, ensuring adherence to the protocols and the processes that have been set by the organization.
Yes, ma'am.
Thank you, ma'am. Thank you so much. I'm very thankful to you for believing in me and giving me this opportunity. Thank you so much, ma'am.
You're welcome, Mohini. Lovely. And Sandhya, what is your opinion if we start having this medication champ in all our departments? So
Yes,
that,
I really agree to it. Like if you only wait for only TLs, because in our the scenario, the TLs will be morning. They were quite busy with doctors' rounds, carrying out procedures and all. So any any senior nurse or any nurse with a good amount of experience more than who knows the medication process in the hospital very well can also take this lead.
Yeah,
I
I think
monitor all, yeah.
Yes, I suggest, we put people on rotation for this, maybe
Yes.
for a quarter, one person, so that everybody gets that chance to be a medication safety champion, which will educate everybody. Because if you're leading, you need to know, you need to practice. So on a rotation basis, this will go to every nurse.
And while seeing their like voluntary work and all that out of things, we can also honor them, or we can appreciate them at town halls and all, so that they are being also regarded.
yeah, I think that's very important. We need to appreciate and acknowledge the effort that has been put by our team members. And I think, Lovely, I really liked your idea of putting nurses on a rotational thing, because then this will give an opportunity for all the other team members also to be advocates for medication safety. Yeah, I think that's a great idea. So what is your opinion on the timelines? By what timelines do you think we should be able to implement this medication safety champ concept in our hospital?
So maybe I and Sandhya will discuss it and send you a proposal by say today's Saturday. Maybe by Tuesday, Sandhya,
Yes,
is it good that
definitely.
send a proposal to you?
Yeah, and we will be having this briefing with the TLs and also, and we need to draft the mail for the syringes also. So everything we have a timeline. We'll keep it by Tuesday. We will close this incident so that it doesn't happen in any near future.
Yeah,
And
there was
also
one thing that I was. Sorry, Lovely, go ahead.
Yeah, we'll also plan a training for this champions whom we are identifying.
Yes, definitely.
Okay. Lovely and Sandhya, I was also, kind of deliberating on the points which were raised by Mohini when she was narrating the incident. Like she was saying that she herself was feeling that she was very busy, right? And at the same time, when she approached the TL for, for a cross verification, the team leader also seems to be apparently pretty busy, right? So I also want both of you to please do one task and analyze what is the nurse patient ratio going on in the department.
Yeah.
Is it something that we need to relook? Because that can also be one of our possible reasons for, for this oversight.
Yeah, that we would be looking, ma'am, because there are a lot of reasons, maybe because there may be a manpower issue, there may be an unplanned leaves which had happened on that particular day, or even like multiple rounds which are, because I think Mohini's ward is a multi-department ward. So multiple areas, the doctors must have come. So we would look and we'll give you a report by Tuesday so that
we'll also see that whether the assignments are being done on acuity basis or not.
exactly.
Exactly. Yeah, I think it's very important to have a fair deployment of staff. See the ratios are being maintained, because somewhere directly or indirectly they definitely have a very huge impact on these errors which are being commissioned, right? So Mohini, I want to understand from you when so you did not realize that you've given 2.5 times the prescribed insulin. Until you noticed, the deteriorating clinical signs in the patient condition. So when you checked the RBS, I think you were able to, your RBS kit was easily available, or you had to kind of go and get it from somewhere?
No, ma'am. We have arranged all the essential kits in our ward, and so RBS kit was there in my ward, and we have given assignments for this kits to recheck, and RBS kit was very easy available at that time in my ward.
Okay.
Great.
Okay, so you good. So the RBS, so that means you did not lose time in looking out for the RBS kit. So you picked up the low sugar level, that is 50, and then you escalated to the doctor. So when the doctor, I'm sure, at that point of time, everybody was focusing on, reviving the patient and taking care of the patient. So when the incident happened, how did we get to know, maybe Sandhya and Lavleen, you can also please add on, how did we get to know that we have made an error?
Ma'am, actually, as
How-
she says that as her RCA, we did the RCA, the patient was complaining of dizziness, profuse sweating. So anyway, luckily we had the RBS kit kept near, so she could revive. And by the time the doctor had ordered also. And I also would request you that, ma'am, once we implement all this medical, we would need to do an audit for the verification of it. It may be in this, not only in this area. It may be happening in many of the areas we didn't know. It's actually an eye-opener for all of us. So we need to do an audit also to see that the verification process is happening in all the areas.
I think, Sandhya, you were just bang there. I was just about to say that, we need to have mystery audits, surprise audits in the department, at random times, late evenings, nights, mornings, so that, there is, an awareness amongst the team member that, audits are, happening and they can happen at any time. Sometime, random checks will also give us a lot of insights on, sometimes we believe as, nursing leaders that, once a process is being, conceptualized or is being passed on to the team members, it is being adhered, in its true sense. But that's not the case in actual, cases. And I think this is one such example that we all have come across. That I understand, that syringe confusion that Mohini had was quite a valid point. She probably was not, used to this, two different forms of syringe, and that is why, she ended up having an error. But the cross verification that did not happen is a major concern for me here, because it's something that everybody knew, and despite that, nobody paid importance or seriousness to this check. It is rightly said that nurse is the last barrier in most cases. When we talk about error prevention. So if Mohini had made a mistake by picking up a wrong syringe or loading 2.5 times the prescribed dose, if this cross verification was being done by a senior team leader, we would have definitely prevented this, right?
Yes.
So it's very important for all of us to always be on guards on such lookout for such checkpoints or preventable errors, so that we don't learn them by actually making those errors, but by from experience. This incident has to be disseminated to all the nurses, and we can have obviously maintaining the confidentiality and anonymity of the nurse, but I think the learnings have to be percolated down to all the team members, right?
Sure.
So Lavleen and Sandhya, so I'm going to wait for the proposal for the administrative control and for the
Sure.
Patient safety champs from both of you. And Mohini, my take on you is that as long as you admit, learn, and do the right thing in future, you are on the right path. Okay, and there is no blame game. I think this incident, I'm sure, has taught you a lot of learnings and taught us also a lot of implementation that or amendments we have to make in our processes. And now your responsibility is to be a safe nurse. When I'm saying safe nurse, in all the procedures that you do for the patient. And I'm sure that the sessions that you're going to take in future for the young nurses, for your colleagues, for your seniors, will make them understand the importance of every step check when it comes to medication administration. Right?
Yes,
So I think with this, we will conclude, and we will definitely like to see the progress of the implementation. And Laveen and Sandhya, you can discuss with me the findings of the mystery audits and how this medication safety champion concept has been rolled out, and what is people say on this concept.
Sure,
Right?
ma'am. Thank you so much for being so supportive and guiding. And we'll surely ensure that all the processes are strengthened much in patient safety. And Mohini, we are there with you in your learnings, in your career, in your job. We have all been through all this. Thank you so much, ma'am. Thank you, Sandhya.
Thank you, ma'am.
Thank you. Thank you, ma'am.
Thank you, Sandhya. Thank you, lovely. Thank you, Moini.
Thank you, ma'am.
Thank you, Haryana team. Just once again, I just wanted to inform everyone, please understand while they are discussing this, that, this incident is not directly connected to any of their, what you call, and any of their hospitals. This, incident has been taken from the collection of, events that we have, collected by the education committee in ANEI. I heard a lot of good things which are happening here. So I want to spend a few minutes. They have been talking for the last, 40 minutes or so, deep diving into the incident. And I really hope that everyone,
closure है इसका.
whether you are a nurse leader, or any role, nursing student, everyone have learned something. So there is this, I used to tell my nurses, the SOPs or the protocols which are, created in the hospital is not for the hospital. It is not only for patient safety. It is also the safety of the nurse, which, in their discussion, it has come out very well. I really appreciate the way that you have conducted the discussion, and team, the patience with which you listen to the staff nurse, commendable. The supportive tone that you had in your voice, commendable. The empathetic view that, Loveleen and Sandhya had taken, commendable. Most importantly, ability to listen to each other. I really want all the people sitting here to look at these, minute details. These are very important when we are running, departments and hospitals, to listen to each other, be empathetic, understanding, there is a whole concept about second victim, Mohini came in with that, she's very apologetic that, she made a mistake. She's not the one who made the mistake. This is a story taken from somewhere else. And this team is kind of did a role play so that all of you can relate to the role. How a staff nurse would respond, how they will feel. And then Anu kind of playing the role of a group CNO, Loveleen and Sandhya coming from a particular unit, and then trying to showcase how a particular incident can be dissected, discussed, and what are the action items that one can take to prevent this in future. So I'm going to ask some questions to the team members sitting here, not the Haryana team who hosted it, to see that, what did you learn today from this discussion? If, young nurse leader, manager, nursing head can tell one or two things that, there were highlights that you learned. Thank you for the nice words, nicely presented. That's very good. If this can reach the patient, it can reach your nurses. If it can reach, result in an action item being taken by you as an individual nurse or you as a nurse leader, oh, this is a good idea. I'm going to do this in my hospital. Then I think this will be a fantastic time that we have spent. Anything and everything that ANEI does, if it will not reach the nurses and it will not reach the patient, then it is all talk. We need to walk the talk. That's why we are having a different format so that you can actually see and feel. Otherwise, it was very easy to give a lecture around that. So thank you to the Haryana team. And let me ask the people who was here, what do you think were the learnings from this last, 40, 45 minutes of the team meeting that they have had? If someone can share that, it will be great. We have Asha Parveen on the screen on the video. So I am going to ask her a question directly. Ski, what did you take it up? You can introduce yourself and then say that, what did you learn? Where are you from?
Yes, ma'am. Good afternoon, ma'am.
Yes,
My name
good
is Asha Parveen from Cloud9 Hospital, Chennai unit, ma'am. So
Okay.
happy to see you, ma'am. So thank you for giving this opportunity to share my learnings, what I have learned today. So after this session, every day we are implementing all the medication safety practices whenever we are come in contact with the medication administration. So today we came to know, so in many hospitals, they are, having a different type of syringes with a different type of, 50 units or 40 units administration level. So before going for any administration, the staff should aware what are all the products is available in that particular hospital, then how she should administer and how she should load the drugs, and that she should aware during the induction period. So when she wants to give any medication, if she is not confident enough, she is not aware of that side effects of that drug dose or any calculation, she should ensure with the team leader or a senior staff who is available during the shift. She should ensure that. And the contraindication of the drugs also the chef should aware. So as we are a professional, we always should go through all the medication what we are going to administer, that point. And also I'm happy to know that this SOP is not only for safeguard the patient or the others, but it also going to protect the staff nurses as well when we are knowing the SOPs and administering or following or implementing in our day-to-day life practice is. So
Thank you. Thank you, Asha, for that. Thank you. I would like to add a little bit to that. Yes, we do expect our nurses to know the medicines, to know the products. But there was a very important point that was discussed that, as a manager or as a leader, how do you, if you look at the hierarchy of the preventive measures, the training is probably lowest in the pyramid. Right on top, you have administrative controls, engineering controls, substitution, and then elimination. Elimination is the right on top. That means if you can eliminate the risk, just remove it. So I'm telling you, I had a similar experience in my life. So there, what I did, it did not take me a minute to decide. I just removed one set of insulin and the insulin syringes. I said, I will decide what to do about it later. I just withdrew the entire lot from all the nursing stations. I just withdrew it. That means I was eliminating the risk. I didn't want to wait, then ask, do those things. This is my personal experience. So I am not asking you to withdraw immediately because it will all depend on the background, the hospital where you're working. But I would like you to learn, as a leader, it is always good to start thinking, can I eliminate the risk? Because you are working with hundreds of nurses. You cannot spend 40 minutes with every staff nurse like this. In this role play, of course, Mohini was lucky. She got the ears of the group nursing head, the nursing head, the educator. But when we go back to real life, we really have to think, can I spend so much of time with every single nurse like this? So we have to think very smart and see that, if there are there are some things that I can do to eliminate the risk, maybe we should try to eliminate the risk, And also, as a leader, we need to think that how do we facilitate the new nurses to get oriented to the organization? Or many times it happens, we draw a plan and we think that the plan is happening. Let me tell you from my experience, the plan does not happen the way you envisioned. So it is very important to go back and look at all those processes, whether it is induction, onboarding, how you are doing your, medication administration privileging, one need to go back and look at. So this is my little bit addition to what Asha is telling. Can I request any staff nurse here, anyone present here, that what did you learn today because you came to this session? We would like to hear from you. What are you promising? Mohini already spoke. Now we would like to hear some other young nurse telling that, ma'am, this is what we picked up today. Anyone? Hello? When getting an opportunity also, we don't like to speak, that's what happens in hospital also. When we call them and say, okay, what can be done? Everybody is quiet. I think this is not going to empower us, ladies and gentlemen. Empowerment will happen when you are able to communicate. So we still have, leaders willing to speak. We want to hear the frontline nurses. I really hope the leaders present here will bring in some nurses to attend here and say that today I would like you to speak. When you get an opportunity, every empower will have an open forum like this, and this is also getting recorded. So when somebody is watching, they are able to relate to people, not all the well-known faces. We'd like to see young nurses. So we have Naina Kutapa there, and after that Lata. Naina, if you would like to speak, can you put on the video and speak, please? Naina?
Yes, ma'am. Good afternoon, ma'am.
Good afternoon.
I'm not able to unmute the video, ma'am, actually.
No worries. Go ahead, speak.
Okay. So myself is Asha. Actually, it's recorded as Naina. I'm working as presently a nursing superintendent and Clear Medi-Radiant Hospital, Mysore.
Mysore, okay.
Yes, ma'am. Clear Medi-Radiant Hospital.
Okay.
Initial 10-15 minutes I couldn't join. I was in the rounds actually. But it was today we had an incident that recall was there. Past 3 days we had one pant injection. There was a reaction. Okay, to recall there was an issue. Okay, and when you told that leader should make a decision, so then I realized that I wanted to tell you.
Okay.
So recall we have taken 3 days actually. I told my assistant to recall it. Then he said they are not agreeing. Finally, I took a decision to recall it. From my side, I have announced the recall. Okay. Then I informed to the MS saying that we can't put the patient on a risk because reaction can be anaphylactic. Any extent it can go. It may take the life of the patient also. Then he said, go ahead, Asha. Okay. Within 2 days, I waited to recall actually with the help of the quality, but I couldn't do it. Today, I have taken a decision and finally we completed with this time. Okay. I was happy that when I heard from you that makes the decision.
Okay.
Then that what I learned is like we have 100 products in the hospitals, which for the new nurses it's critical. For the old nurses, probably they are used to it, but for new nurses who is joining, for them if their products are not at all, they're not aware about the products. When they see the 100 things over, it's difficult for them to learn, and the the things may cause errors to the patient. So it's better to have one product that actually today I realized. These many days I did not realize because recently past 1 month only I'm working as a nursing superintendent. I joined a new job. At the previous I was a nursing superintendent.
Okay.
So
may I know your name again? What's your name?
Asha, ma'am.
Asha. Wow. Great reflections, I should say. You had been a recent nursing superintendent. This is exactly the platform that you should come to learn from people who have been there and done it for a long time. And you have actually come up with the very important thing. Hospital has hundreds of products, hundreds of equipment. There are enough research evidence available that if you can standardize equipment. So in a hospital, you have 10 different syringe pumps. Is it a good idea? It is a bad idea because every nurse is expected to learn every new machine. So operationally, we need to work with our, management people to say it is better to stick to 1 or 2 products just because, because of the commercials, we should not agree to have so many different products in the hospital. So that's why it is time for nursing leaders to get, involved in purchase. Anything that a nurse is going to use, the leader must insist that it should go through my table. You should not be away from it. No leader should be saying that, pata nahi, our administration brought it. There is nothing like pata nahi. we should have the pata, we should have the information. So that's a very good point, Asha, and thank you for joining us from
Thank you,
Mysore.
Thank you,
Great.
ma'am.
We move on to Lata, please. Great recall you did there. Very good. Keep up the confidence. Very important. For patient safety, don't delay. Just take
Yes,
your
ma'am.
call. Talk about it later.
Hi,
Lata,
ma'am.
Very,
Good afternoon. I
yes,
want
ma'am.
very good afternoon, ma'am, and very good
Afternoon.
afternoon to all. So first of all, my congratulations to Haryana team. It is well presented, and almost all the points have been covered, and a few points where it was missed out was covered by Ma'am Thankam. Thank you, ma'am, for that. And I just wanted to make one point to this group is one more part is when we are giving, even Ma'am Thankam was telling that eliminating the risk and be a part of when we are preparing annual formulary. So I think that when we are a part of our annual formulary, the nurse managers, we can take it up very easily to eliminate the risk. Eliminate the risk. Second part, what I felt is at the time of induction, please inform everyone to do the self-reporting. So once if the self-reporting is there, it also can get more elimination of the errors. Third thing, what I thought was motivate the people whoever is self-reporting. So that is what I felt. These are all 3 points what I thought to add up to this group. Thank you, ma'am. Thank you for this opportunity.
Great points, Lata. And Lata happens to be the ANEI Karnataka chapter president. And they are the ones who are going to discuss the next case next month. That is error in OT, identification error in operation theater. So every month we are going to discuss something that can happen in any of the hospitals. So I think your points are very valid. You know, when the nurses come, they should feel safe to report. I think that is very important at the time of induction. I would say for all the people who are leaders, take your 5-10 minutes and meet every batch and tell them, assure them that in case you make a mistake, we are here to listen. Please report. We have a no blame, no name, no shame policy. Explain to them what does that mean. And also the leaders should ensure the mid-level leaders, the nursing managers, they are not being harsh on the nurses, because that is where sometimes things can go wrong. When a nurse made a mistake, she will go and tell her immediate in charge. The in charge will flare up. Then the story becomes something else. You know, what you saw here is an ideal way of managing an error. I really hope that different people having different roles have taken something from here today, that when errors are bound to happen. It will happen. But the most important thing is, can we prevent it from happening again? And again, leaders sitting in our office, we cannot prevent the errors. The nurses who are with the patients, they need to be equipped, empowered, so that they can be safe at the bedside. Yes, the staff nurse's responsibility to receive the information, follow the guidelines, have the courage to speak up. This is very important. I really hope that in the future Empower Hours, more people will come in, share their, experience and knowledge as well, which makes the entire thing more powerful when somebody is adding, then this is my bit to this, And if anyone says that I have never managed an error, then you are a liar, a big liar. Not a single nurse can finish their career without getting exposed to an error. That is the truth of it. I think Manjumol was trying to unmute. Manjumol,
Yes,
do you
ma'am.
want to say something, Manjumol? Yeah.
Yeah, yes, ma'am.
I would
Good
request if
afternoon,
you can come on video, it will be good. It is more effective on the people who are watching. At least they will be happy to see your face.
Okay, ma'am.
You please
So
introduce yourself, where you are and what are you in ANEI also. I'll request all the ANEI members at least should be able to say who you are in ANEI also.
Okay, myself Manju from Kerala chapter. So it was a well executed program from Haryana chapter. Congratulations all the team members. I want to audit senior nursing officer. So first of all, usually we are getting two types of syringes. It is mainly through the senior nursing officers, purchasing. If this type of syringes are being got in the unit, we have to communicate this to our nursing officers. That is one thing we can do. Mummy, heard? Am I audible?
Yes.
On and off little bit, disturbances. They're not able to get everything. Yeah, continue.
I think video is on, ma'am. That's why.
No, I put the video off. I put the video off.
Okay.
Yeah, go ahead.
Okay. So once again, I will tell, we are the one, that is senior nursing officers are the one who are intending these syringes. So if we are getting 40 unit or 100 international unit syringes in our unit, we have to communicate this to our nursing officers. That is the one thing we can do. Then another one is, she told the TL and the nurse who administered the medicine were very busy. So they couldn't do the recheck now. So this time, here come the importance of patient education. If we educated the patient that usually this insulin is taken in the home, no? So if the patients are coming into the hospital, we have to educate them that two type of syringes are available. One is red cap. I think here we have red cap and orange cap. I hope so there also. So orange cap is mainly for 100 international unit and red cap is for 40 international unit. So there come the recheck. It is done by the patient now. If we are going with a red cap syringe, she will immediately identify that yesterday this nurse is administered with a red cap syringe. Today another one is coming with a orange colored capped syringe. So this is one way where we have shortage of staffs are there. This is another way we can educate the patient and identify the errors as early. Thank you, ma'am.
Has opened another completely different angle, a fantastic angle. The SOP, I'm not going to, SOP will remain. There is a double check by another nurse, but definitely there is a need to involve patients and families in their care. So another thing that is coming up is the insulin should be prepared at the bedside. And it's very important so that you're talking to the patient. I don't know, this is one practice when I was a staff nurse, it always helped me. So when I reach, if I have to give insulin, I will tell the patient, okay, Mr. Johnson, you are due for your insulin. So let's see how much insulin is ordered. Okay, you have 8 units of Mixtard that is ordered. Okay, this is what I have. And I'm going to draw. So every time I'm explaining to the patient, my brain is doing a double check. So I think Mohini mentioned, she cannot do without self double checks. It doesn't matter whoever is double checking for you, even they can make a mistake. As a staff nurse, this is what I learned. Don't depend on anybody else checking the medicine for you. Do it yourself diligently. 2-3 checks that you learn in the nursing school is something not for fun. It has to be followed, and then we can be giving safer care. So I think involving patients and families is a great way of making them partner to your journey of being a safe nurse. So you should not let it go. This is a great practice for any nurse to have that, communicate with the patient what you are doing. So they will be able to. And I personally, I still believe that if you can do with one type of insulin syringe, that is the type you should be using it, because you are not going to eliminate whatever education or training you give, you will not be able to eliminate it. But if you remove the syringe, in Hindi, there is a saying, na rahegi bas to na bajegi basuri. Correct? If you take it away, then how can anybody make a mistake? I would still, advocate for that, unless there is a very good reason to keep both. I cannot see a very good reason to keep both. So it is possible to be done that. So I'll come back to the team who were discussing the, event for all of us. Do you have anything more to add after listening to the reflections from others? Can we sum up the the points that you discussed and what they discussed, put it in a list format, it's kind of summing it up so that, we can wrap up the session. We'll start with Anu.
Yeah, I think, ma'am, before we do that, I was just listening to everybody and I was trying to, do a reflection of my clinical experience also. Most often we have this, notion that, most errors are being made by young nurses, but that's not true. I have seen the worst, worst clinical errors being made by the most experienced nurses. And as it is rightly said, that most experienced drivers make the most worst accidents. So more often we pay a lot of emphasis on, the young nurses induction and everything. But I think overconfidence and too much reliance on say, liability in terms of years of experience or by designation, we kind of feel that, we are kind of protected, and we kind of overlook the checks and, and have a tendency to deviate from the set protocols. So this is something that I would want to re-emphasize to this larger group here, that at any point of our career, maybe with 1 year experience or with 25 years of experience, we all are at the same stage. We all have equal chances of making an error. So please be mindful of this. And second thing is, in like this Mohini case that we were discussing on, the double dose of insulin that has gone by. Trust me, this would have gone unnoticed if the patient condition had not deteriorated, right? Because she herself did not realize that she had made a mistake, unless we saw, patient having those symptoms. So sometimes you may be in a situation where you will not realize that you have made a mistake, and you will only realize it when the patient shows up, or and probably your mistake goes unnoticed. But my submission to all of you is that there will definitely be few instances, because I have worked as a bedside nurse, myself, and I've also seen a lot of examples where the nurses do realize, some percentage of nurses do realize after making a medication error that they have made an error. But the problem is they just, wait and see, if nothing happens to the patient, we'll be quiet, or they have fear of reporting, as Manju was saying. So I think in many cases, I have seen that if the nurse has made a mistake, and if she had promptly reported, many of the adverse events could have been countered. We could have done some preventive measures. Some antidotes would have been given, and many times the doctors or the senior nursing leaders question this nurse. If you had got to know that you have made a mistake, why did you not report? If you had reported, we could have done this, could have done that. Then you are in double guilt. First, you have made a mistake, and secondly, that if you had reported, still there was chances of probably patient survival or patient would not have ended up going to ICU. So these are the two things that I would really want all of us to be very cognizant at all the times, that as ma'am said, we are all human beings, we are not robots, so we have a tendency to make errors, and by design we will make error. So I think preventing is the best thing, and I think second is correction. If you made a mistake, be prompt in escalating, so that some damage control can be done. Right. So these were the 2 points that I wanted to talk. And I think I really like Manju's point on patient education. That patients are nowadays very educated. They will catch you for the different color of tablet, or if you're giving a medication at a different time, they will question you. So I think involving patient in their education is also a very, very important point, because they are one set of people who can actually also identify significant amount of errors.
Thank you.
Thank you.
Anu. Any note from Loveleen, Sandhya, kind of sum it up what we have agreed? I think one point that Anu just mentioned, and this is a problem across the hospitals across the world, reporting of near miss. So if the iceberg phenomenon, the ice that is seen above the sea, that is our sentinel event. That means, something happened to the patient, it will be 100% reported. So as Anu told, something below that iceberg is where the potential for creating safety is sitting. That is our near miss. And I tell you from my personal experience, I totally agree with Anu. Once you made the mistake, I still remember the medication error I have made as a bedside nurse. I still remember which patient, but thankfully they were not big errors. You know, instead of giving 80 milligram Lasix, I gave only 40 milligram Lasix. So after some time, when I was, I signed off also. But when the next dose came, I realized, oh my God, I gave only one in the morning. I did not give two. Oh, I went to the doctor. I said, I'm so sorry. I gave. Then he said, okay, relax, relax, relax. And I said, I listened to the patient. This is the output. I started, getting so worked up. Doctor said, it's relax. Nothing happened to the patient. Good that you reported. So then that day I told my son, I should read my order. I should check my medicines 3 times before, because all my patients were unconscious. I was ICU nurse. And another error was with the digoxin. Fortunately, God was kind that these were the 2 errors. And I mean, I reported both of them. Nothing happened because I realized I made the mistake. And that's what Anu was trying to tell. Most of the nurses kind of get it, oh my God, I gave less, I gave wrong. Something they will realize. It is better to report that. And if we can capture near misses, imagine the amount of safety that we can push into the processes. If we know that this is what is, allowing you to make a mistake. So the training methodologies will change. How we focus on discussing will change. Just the way that today we learn how to approach a error and how to get the best out of all the team members in the hospital. Not that you shoot the nurse. Error ho gaya, fish, kill the nurse and that's it. So you will kill the nurse and you will kill the entire process also. So great thoughts, and I'm so happy that people are sharing their thought process. We are getting richer by learning. So over to Loveleen and Sandhya, and then I'll move to Mohini to wrap up that. How did you find this session? Did you learn yourself some new things because you got this opportunity to think 40 minutes undisturbed? You understand? You in the hospital, you may not get this time because 20 times somebody will come to your office. So will you cap it up for all the people sitting here? Lovely, and then Sandhya.
Yeah, sure, ma'am. As you rightly said, be your own checker. Check yourself, because I know about an incident where the junior nurse was right in her calculation of heparin, where the senior nurse told, no, it's not that, and then ended up giving higher doses of heparin to the patient, the coagulation profile going haywire. When the junior nurse recognized it and went to reduce the dose, the patient said, no, sister, वो बड़े वाले sister ने बोला था वो सही होगी. So be your own checker. I mean, thrice, 4 times, 5 times, check it, double check it. If you are in doubt, check from a third person, rather than second person, third person. And the second one is, the self-reporting, encouraging self-reporters is one thing we had a practice of, encouraging, calling up the names of self-reporters in our general managers meeting, where in front of everybody, and appreciating and rewarding them. Every small errors used to come out. Everybody were so motivated to report that I was about to do this, I somehow stopped it. So all those were turning into as learning lessons. So I think we should take that forward in every place, that motivating end nurses to report errors. Thank you so much for giving the opportunity, ma'am. Thank you, ANEI members.
Thank you, Haryana team. Sandhya.
Ma'am, I don't have nothing much to pay because everything has been spoken. So my only thing is that to create that knowledge. The knowledge actually works everything, and the confidence in every nurse in your hospital to come up and to confide in your administrator that, and that administrator should be open up at any time. So that's the only thing.
Okay. Yes, when we ask the nurses to report, we have to create that environment for them to report. A listening environment, a receptive environment. So I really like the idea when Loveleen said, you are recognizing people in general meetings, that so and so. So that takes me to some case study I read many years ago. It was called red flag process. Red flag means anybody can say there is a problem, and it could be a machine also not working. So they will report, it's not their machine, but they found it's not safe. It's like I'm walking down and I find a wheelchair without a patient strap. So I could report that to say, I'm not working in OPD, but I report that in OPD, I found a wheelchair without a patient belt. So that became a very important process this is a hospital outside India. It worked. I think they called it as red flag. And then after that, they actually created red flag stickers. So anybody can, write their name and stick it on the thing and say, now this is a unsafe thing. I thought that was a brilliant idea. So there are many ways to encourage people to report. I think that's a major takeaway from here. We would love to hear from our nurses. They were about to make a mistake or they made a mistake, but nothing happened to the patient, fortunately. But nevertheless, please report. Now, the last word is going to be from our actor staff nurse, Mohini. So how did you feel this entire exercise of being here and participating with the leaders? So how did you feel?
Thank you so much, ma'am. Firstly, thank you so much for giving me this opportunity. Yeah, really, when these incidents happen, and incidents like this happened, so all the nurses and all the co-workers felt like same as I have felt during this acting. And thank you to all the higher authorities and ANES ma'am and group educator, group nursing director and head educator to support any of these staff and cooperating them and listening them very very carefully. And I think all of the nurses would have felt same like this. So this is really very very appreciable.
Okay, great. Thank you, Mohini. And the message out to all the nurses is that we leaders, we want to do this with each one of you. So be open, inform, tell us. And, I'm very sure the message is going out to all the leaders. Please be kind, be listening. And your job is to find out how to prevent that mistake by any of your nurses. Your job is not to punish the nurse. The job is not to take her 1 day off, to cut her salary. My God, these are unbelievable interventions that any nurse leader can ever take. And I mean, I'm just telling this loudly that in case someone thinks that that is going to fix the problem, it is not going to fix the problem. It will hide the problems. People will not come forward. So let's be adopting a no blame, no shame, no name culture. I think that starts with the leader. So ANEI stands for preventing, preventable harm. And all these interventions we are planning is to improve our nurses, empower the nurses so that they become safer and we deliver safer care. At the end of it, the entire healthcare industry is their right, is a patient's right to get safe care, and it is our endeavor to give safe care. And it is, since it is a human intense industry, it needs human intense interventions to ensure the safety is, maintained all the time. So thank you very much for everyone to being here. And I do see some of our national office bearers here. So immediately I'm able to see Aji on the screen. So would you like to say a line or two, Aji? Or if Vinci or Unmana, anyone who's there, let everybody see the new office bearers also. Yes, Aji.
Good afternoon and good afternoon, everyone. We have made it as a culture, the ANEI has made it as a culture of having empower hours. And the main aim of empowering our nurses by preventing harm, thus ensuring patient safety. And very useful sessions, well conducted, well modulated, well organized sessions. And thanks, Sangam ma'am, for taking all the effort to continue to, the sustainability of it, it's very, commendable one, ma'am. But I request all chapter heads to ensure that maximum attendance, because even though we will have recorded sessions and everything, but this interaction, the opportunity for you to express your feelings will not get it in recorded session. So it's a kind request for everyone to have maximum attendance and maximum participation. Thank you, ma'am. Thank you so much. Have a great day.
Good
Thank you
afternoon.
very much.
Good afternoon, ma'am. Vinci here.
Yeah, hi, Vinci.
Hi,
Yes.
good. Yeah, can't come in the video, ma'am. At home mode. And anyhow, thanking and kickstarting this session of 2023 with this wonderful session, which is very close to all our hearts, especially mine, medication safety and errors. And I completely agree with Tangam madam when she says that as leaders, we have to create that environment where a nurse is not at all scared to speak out. She has committed one or she was about to commit one. So it's more about whether we have facilitated that environment. That's very, very important. You facilitate the environment, see how many are forthcoming. Even try to do some appreciation. Why only appreciate when good things are happening? Like let them talk out and appreciate the ones for self-reporting. Some of the organizations have it. So again, I agree with Aji, chapter heads, because I also saw the participants. Sorry, I joined little late, and numbers are still can be increased in multitude. So all the chapter heads, once more, this is a very enriching and a very rich session for the mind, for the practice. So let us all come forward and take these sessions very seriously. Thank you, ma'am. Thank you. For being a role model for us and for our young nurses. Thank you.
Thank you so much. It gives me great pleasure to see all the younger leaders like Dr. Anu Kaushik, Miss Loveleen, Lieutenant Colonel Sandhya, and of course our young nurse Mohini, coming together and showcasing that how we can deal with an error in a hospital. Thank you so much. And thanks to all the people who have contributed to that. I am very curious to ask one screen with Farita Begum. Where are you from? I have been seeing them sitting there. I hope you listened to all of us and you learned something. Where are you from?
Ma'am, Parita Begum is outside. I'm Lakshmi, ma'am, from Ranchi.
Ranchi.
Yes, ma'am.
Okay. Great. So nice to see that, we have people from all across India. That gives a lot of hope, and this recording will be available on our YouTube. And thank you so much, the Haryana team. Thank you very much.
Thank you, ma'am.
Next month, just give me 1 second. I will just show the, slides once again. Thank you all of you for committing to patient safety. And next month, we will have, I'm sorry, it is not Haryana chapter. It will be Karnataka chapter. That's a typo error. We are going to discuss identification error in OT. And that is what Madam Lata Nonis, Miss Lata Nonis, who is the Karnataka chapter head, will be planning to showcase for all of you. And we try to host this every 4th Saturday, 11 a.m. You can note it, and unless, there is something else that's happening, otherwise it is. So really, one idea is to get your people into a classroom and let them all listen and see together and make one spokesperson if they want to come near the laptop and speak. So there is many different ways to increase the viewership. And very rightly, Vinci told, you will get an opportunity. No, I think it's Ajay who mentioned that, only when you're here, you can share. If you're not here, you cannot share. So thank you once again. And a very big thank you and shout out to the Haryana team. Thank you very much, and see you all next month. Are we good? Thank you.
Yes,
thank you. Bye-bye and take care. And be safe. Be safe.
Thank you, ma'am.
Thank you. Bye.